All right. Good morning, distinguished ladies and gentlemen. Yes, for some of us that don't know, my name is Yor, and then I'm a radio personality amateur, also a presenter. Then it gives me great pleasure to be the one moderating this webinar. All right, so please, doctors, good morning.
I think you have two devices on. You need to put off one.
Yeah. All right. Good morning, doctor. Good morning, doctor. And then great corpus. Can you hear me, sir? Can you hear me?
We can hear you loud and clear, yes.
Yes, sir. Good morning, doctor. And then good morning, Alaji, and then I greet everyone. All right, so we're here today to see how we're going to move our fellow coppers. They call them Otondo. That's what they call coppers, basically. And the importance of keeping both social distancing and then helping to propagate the work that NCDC is doing for the prevention and the control of this dreaded disease called COVID-19, and how we can all live with it. So that's why we're here this morning to discuss with our panelists and then just move forward. All right, so let me check what we have on the program. If we have, thank you so much, sir. The NYSC DG, thank you so much for joining us. Brigadier General Shuaibu Ibrahim, and then of course the NCDC DG, Dr. Chikwe Ihekwesu. Welcome, sirs.
Thank you very much.
Welcome, sir. Also we have, once I get the names, I can see Alhaji Abubakar is there with us. Alhaji, good morning. Good morning. If you can hear me loud and clear.
I hear you loud and clear.
Thank you so much, Alhaji. And then I don't know if we have Dr. Disu. Is Dr. Disu there now? Dr. Disu, are you with us?
Good morning. Good morning. Yeah, I'm talking. How are you?
I hear you. It's still not loud. And then Dr. Disu, we can't hear you clearly. And
Hello?
then
Hello?
Hello, is that Dr. Disu?
Hello?
Hello, doctor. Yeah,
Yes.
good morning. Hello, can you hear me?
Hello?
Yeah, hello, doctor.
Dr. Disi, we can hear you. Please go on.
Okay.
All right. All right. And also, we have with us Dr. Lami. Good morning, doctor. We spoke yesterday. Good morning.
Good morning, Yo. I'm Dr. Ladu.
Yeah. Dr. Ladu, good morning, doctor.
Morning.
And then, yes. So today, we have our core members in the house. Okay, Dr. Yelado, good morning. All right. And we have our core members in the house, and then we are starting off with the national anthem, and then afterwards we take the core members and their anthem also. Can we have the anthem, please, if we're ready for this? can we have the anthem for the intending corpus? That's the next one for us to have right now.
Praise so. The Henry Shelter at the count of 2, 1, 2.
That I'll just disconnect since I answer more network problem.
Thank you so much. Thank you for the anthems. And then, all right, please, some of the rules that we will be following through as we go on with this webinar. And this is the second one that we're having for corpus. Okay, please, corpus, please take note if you're there. Just write down the questions that you may have so that at the end of everything that we're going to say, you can throw in your questions. And then your questions, you can only just type in the questions at the question and answer section on your system. That's where you can just drop in your questions, and then we'll take some random questions. We'll read out some of the questions that we have as time permits, us this morning. So please, and just go straight to the point when you're asking those questions. And then our panelists also will be ready to talk to us, and then as we progress, and then they have a particular time allocated to them, and that have also been sent to them to talk to us during this whole segment, for this segment. But for now, we will be going on straight. Let the DG of NYSC give us his welcome speech this morning, Brigadier General Shuaibu Ibrahim. Brigadier, you can unmute your mic and please just talk to us for a few minutes. Thank you.
Thank you very much. The DG NCDC. The DG NCDC, our guest speakers, my distinguished prospective corps members, members of the press, ladies and gentlemen, it is indeed a privilege and honor to address you this morning on our preparation for the forthcoming Part B Stage 2 orientation exercise. I want to use this opportunity to thank the Director General of the NCDC and team for the wonderful and excellent job. Indeed, if not for the NCDC, of course, our orientation would have been back. So, for the wonderful job that they will continue to appreciate them. All that we are saying, the essence of this meeting is to sensitize our prospective corps members on the need for them to take responsibilities when the camp opens, because they must adhere strictly to the protocols, because if anything untoward happens from their side, they know the consequences. So there is a need for us and the NCDC to be on the same page so that we have a hitch-free exercise. I want to use the opportunity also to welcome Ali Baba. It is a privilege and to see you today, talk to my prospective corps members. Thank you very much. And others, the producer from the Wazobia FM, it is indeed, we are happy to have you. And our prospective corps members, just as I said earlier, please, you must adhere strictly to the protocol. And at the same time, you have to be very, very conscious of your security. You must not endanger your safety. Please don't travel at night. If you have cause to travel on a long distance, please cut your journey into two. I know you may likely ask later in our discussion when your call-up letters will be released. Immediately we finish this program, your call-up letters will be released to you immediately. So on this note, I want to once again thank the DG NCDC and the NCDC for the excellent partnership that we're doing. And I can assure you that with cooperation among the two agencies, we are going to have a hitch-free orientation course. Thank you, and God bless you all.
Thank you so much, DG. Thank you. Thank you. And then, bros, like we love to call Ali Baba bros, Ali Baba, comedian, content creator, COVID survivor, like he likes to call himself now. We welcome you also. Don't know if you are here now. Ali Baba, bros, are you there?
He's there. He's raising his hand.
Ali Baba, okay. While we wait for him to say a word or two. After now. Please let us have the opening remarks by our DG, who is more like our host for today, the DG of NCDC, Dr. Chikwe Ihe Kweazu. Please let us have his own opening remark now.
Thank you very much, my brother. This is really firstly to recognize my brother, dear friend, colleague, Brigadier General Shaibu Ibrahim, DG of NYSC. Really been a pleasure, sir, to work with you and your fantastic team on this effort, incredible effort for the country. Really acknowledging your presence, your team, definitely all the prospective core members on this conference, Zoom conference. I can see we have close to 600 attendees already. A fantastic turnout so far. We expect even more. Members of the press, gentlemen, ladies, thank you very much for joining this incredible opportunity today to share experiences and to prepare for the third stream. You know, for prospective core members, you know, I can really imagine how you feel. In 1995, when I was about to start my youth service journey, I was posted to Lagos, ultimately posted to the police college in Ikeja, Lagos. I remember the sense of joy, sense of responsibility, but a little bit of anxiety as well. The first time one was living outside the protected environments of your university or home. So it is a daunting challenge on its own, exciting and daunting. And in addition to it, we are doing this in incredible times, you know, in a period where we are facing the biggest public health challenge of our lifetimes, all of us. And that's the reason why your camp year, your period in camp and your youth service year has been delayed for so long. But together with our colleagues at NYSC, we came up with a very difficult decision and convinced our leadership that we cannot delay this any longer, that we have to get on with it. But in order to get on with it, we have to make some extra sacrifices and put in some extra measures. So together with the leadership of NYSC, we have done our very best. We worked for months. Teams, colleagues on both teams have done everything possible within the context of our country to make this as successful as possible. For you to start this extremely important phase of your life. So this is really a unique opportunity. And I just wanted to say a few words because you will hear a lot of things. You will hear about some risk involved. And you know, anyone that understands risk will know that there's nothing like zero risk, nothing. Every day we wake up and we enter a vehicle to go to work or to go to school, there are risks involved. So there's absolutely nothing like zero risk. What we're doing collectively is to mitigate those risks, to minimize them as much as possible. And that is why we have put in all these measures. You will hear about some of them. Your colleagues would have told you about some of them. About testing prior to entry into the camp, about wearing masks while in camp, about increasing the distancing we all have from each other, about closing some of the markets that we enjoy going to limiting the amount of time we spend together. These are sacrifices that you have had to make because this is the only way we can proceed. The alternative would be to delay this indefinitely, which is not an option any of us wanted to take. So really, You are now adults. You're no longer children. So we've got to work together. This is a joint effort with you. So this is really to call on all prospective core members to join hands with the NYSC officials, the state and NCDC colleagues that will be working with you. Nobody wants to police the work you do. We're not law enforcement agents. We are collaborators in the goal to have you participate in a successful youth service year. So we need your support. We need you to support each other, to yourself try and be as disciplined as possible, but also to support others. So when you see someone not wearing a mask, you call up the person, in any way you want and say, bros, listen, put on that mask. It's also for my safety and yours. So we will really like you to grow as leaders, take responsibility, and work with us in developing these measures so that we can celebrate the success together. So these are the few words I have for you. I really wish all the prospective core members a great few weeks in camp. I wish you a successful youth service year. It's always a transformational experience for many of us. It's one of the greatest innovations in Nigeria, this opportunity to serve for 1 year, serve your country. It has changed many people's lives. I am sure it will change yours. And I look forward, myself and my team, and I'm sure everyone in the NYSC team as well, look forward to working with you and celebrating with you at the end of this. And please, if there are any problems through the journey, nothing happens without problems. Please remember, not everything needs immediate escalation worldwide. Give us the opportunity to solve that problem with you. If everything doesn't work perfectly in every state in Nigeria from the first day, please let us know. Let us find a solution together. If we don't find, we can escalate, but give us the opportunity to work with you in finding solutions to any problems that we'll face. Finally, this is really to thank everybody, the moderators, the organizers, the team at the back of the cameras that have worked so hard in putting this event together, but really putting the whole reopening of NYSC camps together. It's been an incredible journey. I think it's one that our leaders will be extremely proud of if we continue to achieve this successfully, and really grateful to all Nigerians for your support through this very difficult period in our national life. So thank you very much. I look forward to an excellent event this morning. Thank you.
Thank you so much, DG, for that. We truly appreciate. Thank you. And then please, our core members, just take notes because we will be having a panel session soon where we will discuss, don't forget I said that earlier, and then we have the DG of the NYSC joining us for that. And of course, the Dr. Yenladun will also be there. She is the NYSC Safe Reopening Project Lead. And then we have Dr. Yaya Disu, who is the NCDC head of these comms. So please don't go anywhere. We promise to make this as fast as possible, but it will really, really impactful for us this morning. All right, and then right about now, it's for us to go to the next thing on the program, which is the first session, and then plans for safe reopening of the camp. And Dr. Ladu is there. She's the NCDC project lead, Safe Camp Reopening. Dr. Ladu, you have the floor now.
Thank you so much, Yo. Good morning, everyone. Permit me to start by recognizing our host. I'll call him our host, Director General, NYSC, Brigadier General Shoaib Ibrahim. He has permitted us and allow us to work freely with his team. I would like to acknowledge your support, acknowledge your cooperation in this project, and also to acknowledge the support of the entire NYSC team in this project. We acknowledge you, sir. And just like I've been saying at the beginning of this program, I'm the only one with the 2 DGs. So permit me also to recognize the presence of our DG NCDC, in person of Dr. Chikwe Iwekazo. We acknowledge your support as well, sir. And also my colleagues that we've been working together on this project, Dr. Yaya Disu, Alaji Abubakar Musa, Emeka, and all the comms team, as well as the IT team. We appreciate you all. And also to all the prospective core members, thank you for being here. And let me continue to stand on the existing protocol, and permit me to share my screen. Okay. Can we all see my screen?
Yes, yes.
Okay, so we'll quickly go through what are the measures that we have put in place to ensure that we have a safe reopening of NYSC camp, and also looking at the second wave that the country is going through now. What are those measures that we need to really enforce to ensure that we don't have significant increase in number of cases in the country? At form of a background, just to give us a bit of understanding of where we are in terms of COVID-19 in the country, this outbreak started in Nigeria on the 27th of February, where we recorded the first case in Ogun State, and the case was managed in Lagos State. And in March 2020, precisely 19th of March, WHO declared COVID-19 a pandemic, means a worldwide outbreak. And it involves taking some extra measures to ensure that we curtail this infection at a whole. And as at 15th of January, this is a year after we're still battling with the same outbreak. As at 15th of January today, 2021, Nigeria has recorded over 100,000 cases of COVID-19 with over 1,000 deaths. These are human beings. These are people like you and I that have died due to this COVID outbreak. And at the beginning of the outbreak, as a control strategy, the country went into into lockdown to limit the transmission of this infection. And in the process of the lockdown, all the sectors were involved: businesses, schools, educations were not spared, the primary, secondary, tertiary, as well as the ongoing NYSC orientation camp then were suspended. But with better understanding of the outbreak and a form of strategy in our response, the country commenced phased ease of lockdown and reopening of activities. We started opening up sectors. We opened up aviation and other sectors. And one of them was a resumption of NYSC program, which started since November 2020. We work in collaboration with NYSC management as well as the Presidential Task Force to develop a safe reopening guidelines for core members across the country. The protocol is meant to be implemented in all the camps to ensure safe opening and smooth operation of camp based on COVID-19 protocols in the country. And one of the activity is to ensure that we give accurate and correct information to prospective core members that are going into camp, so that they will be well equipped on what is expected of them ahead of the camp in terms of the safety measures, and what is expected of them when they're in the camp environment. So the aim of this webinar is to familiarize our prospective core members with the processes and the expectations for safe NYSC camp activities. And the objective is to ensure that we sensitize them on the measures and the protocols that we have put in place to limit COVID-19 infection and transmission in camp. And we also want to use this opportunity to seek their cooperation because it's a different thing to put protocol in place, and it's a different thing to ensure that it's being implemented. We want to ensure that we seek their cooperation towards the safe camp orientation activities. And they need to also understand the process, and also it's a forum for us to address some of their concerns before arrival in camp. And we'll use this medium to link them to reliable sources of information. There are a lot of information in the media, a lot of rumors going on about COVID-19, especially that it is false. Government is paying some people to come out to claim, and now a lot of false information about COVID vaccine. So we want to use this forum to link them to reliable source of information about COVID-19 and other infectious diseases in general. So this is just to give a brief understanding of the framework that we're running currently with the NYSC camp. We started a form of a phase-out NYSC camp reopening to ensure that we limit the number of core members that will be in camp orientation part-time. And we started since November in 3 batches. We've run the first batch. We've run the second batch successfully with NYSC. And this is the last batch. This is the last stream of this particular batch, which would open next week, Monday. So to give a brief background of what is expected of them before they go to the camp. So we have worked with NCDC, we've worked with NYSC and PTF, Presidential Task Force, to develop guidelines for camp orientation. And the guidelines it states that compulsorily every core members will be tested on arrival. Please note, on arrival, when they arrive to the camp. So even if you come to camp with already with results from anywhere, any state, you will still be mandated to get tested while in camp. And to simplify this process, so that at the end of the day, they won't get to camp and start filling forms and start waiting time. We have worked also with NYSC to develop a simplified link to make it easy. We have developed set of questions that they're supposed to fill and develop a link on our e-platform, electronic platform that we normally use to capture data, known as SUMMERS. And this link is being hosted on NYSC portal. So individual portal, just like Director General said, at the end of this webinar, they will be allowed to fill in their details. Their portal will be active. So on this portal, there is going to be a set of questions, a link from NCDC, just like what we're seeing, which once you click on continue, it will lead you to the form, set of questions that you're supposed to fill. And once you fill these and you submit, you click submit, you have to generate a slip and a code that you print and bring to camp. We have our officials in camp that will collect this slip and verify your information, because the information is being captured on our own data platform, and they will look through the data platform of the SUMMERS database and verify your information. Once this is verified, you proceed to sample collection site, where your sample will be taken immediately and a rapid test will be done at the spot, on the same spot, and you have a waiting time of about 15 minutes for your results to be ready. Once the result is ready, the result will be uploaded immediately on the same platform, on the same portal, and it will generate an automatic test message on your phone, on your registered phone number. This test message is what you will now take to NYSC officials as an evidence that you have done the test, and this is the result for you to proceed to register. Please note that without going through this process, you will not be able to register in camp. And it's important for us to note that at this point that those who are negative are the ones allowed to register to proceed for registration. Those who are positive will still go through what we call a confirmatory test before they are registered in camp. So let's now take a look at what are these protocols? What are the things that are highlighted in the protocols for us to note? First of all, it's important for us, as part of the necessity, is for us to familiarize ourselves with this guideline. The guideline is available on NCDC website, and is going to be available also. There will be a link on NYSC portal, on your individual portal, for you to also download the guideline and read and familiarize yourself with this guideline before you come to camp. It is very easy to read, very easy to understand, and also it's in a grammar that you can easily understand. Part of the procedure for camp is for us to note that the camp orientations the core members are batched. That is very important for us to note. One of the key things for this camp activity is to ensure that we maintain physical distance as much as possible in the camp environment. And how do we maintain this if we have all the core members coming in at any particular time of the day to start waiting to go through sample collection, test, and all that? So we've simplified this in such a way that core members are batched in a number of 200 to resume daily. So when you fill your information on the portal and you get your verification slip, a particular date will be noted on your slip for you to resume. Please, I want to encourage us and enjoin us to resume on the date you are given. If you come a day before or you come a day after, you may not be allowed into camp, because you're going to join the other batch, and there's going to be a lot of confusion and increase in the number of core members for the next day. So let's take note of the date you're given and strictly, compulsorily resume on that day. We're going to go through testing, which I have explained the procedure, and there is going to be a strict infection prevention control measures in camp. What do I mean by this? It's not something highfalutin. It's as simple as come with your face mask. Each core members are expected to come to camp with their face mask, and not NCDC or NYSC providing it for them in the camp. If you don't come with your face mask, you may not be allowed into the camp until you provide that. Please ensure you come with your hand sanitizers. Yes, hand sanitizers will be provided, but you need to ensure that you have your own with you at all times. In terms of other supplies, running water and soap, all this will be provided, and you are expected to wash your hands at strategic positions and strategic places at every activities being conducted in camp. And also for us to note that there will be mandatory temperature check at strategic places in camp, be it in your hostel, be it coming out of the hostel, campground, Mami Market, going to the dining. There will be temperature check at each strategic position in camp, and also would ensure that we maintain physical distance everywhere in camp. That is the essence of limiting the number of core members per camp orientation activities. So in the hostel, each person on a double bunk bed, it's only one person that is allowed on the bed. In the parade ground, there is going to be physical distance as much as possible. In the dining, every area of the camp activities have been marked where to ensure that we don't cluster together. And it's important for us to note that some gatherings may not be allowed at this period. In terms of going to the Mami Market with friends and colleagues to sit down and have fun, there won't be any form of religious gathering in camp at this time. We encourage virtual worship as much as possible. And for orientation activities, in terms of lectures, special events, we're going to ensure that we use virtual lectures during this orientation period. And so as youth and as core members, what are your major concerns? One, it's about your safety, which is not only your concern alone. It's a concern of your parents that are releasing you to camp at this time. And it's a concern of us as the government to ensure your safety while you are within the NYSC camp orientation activities. So we want to comply everyone that measures have been put in place to ensure your safety, to ensure that we are protected and limit transmission of COVID-19. Just like DGNY NCDC said, we can't actually have zero risk, but we can reduce our risk as much as possible. Let's ensure that we strictly comply to all the measures that have been put in place in the orientation activities. It may be inconvenient, especially when you have to be on mask all through, but that is the new normal. And we have to ensure that we adjust to this new normal for our safety and for other activities to keep going on, because I'm very sure majority of us are tired of staying at home. If we don't comply, the only other option we have is a lockdown, is to stay back at home and ensure that no camp activities. But I'm sure we would not want something like that. We want to enjoy us. We want to, I want to join us to ensure that we strictly keep to the guidelines and the protocols that we've put in place. And while doing this, as we all know as youth, our main aim of going to camp is to ensure that we have fun. As much as possible within the new normal, we're still going to have fun. We're still going to enjoy ourselves within what is permissible during this pandemic. And in terms of cautions, we need to ensure, yes, there's going to be a lot of physical distancing in camp activities, which may be difficult. But just like I mentioned, in line with the new normal, we have to adjust to the new lifestyle of living to accommodate this process. And also, there will be no religious gathering, like I've said. Mami markets has been significantly reduced in line with the new normal. So there would be no crowding allowed or permitted in the Mami market. So there is nothing like sitting down to dine in the Mami market environment or to marry with colleagues and friends. But we are allowed to go to the Mami market and do takeaway, but not allowed to gather. And of course, in terms of lectures will be conducted virtually and will be complemented with e-learning tools as much as possible. All these measures have been put in place by NYSC to ensure that you strictly follow due process of NCDC COVID protocol. And in conclusion, I would like to conclude by saying that on the right is the guideline, which we're going to get the link to where to download and read on our website. We need to ensure that you familiarize yourself with the guideline as much as possible. Measures have been put in place to ensure your safety in camp and limit the transmission of COVID-19. Also, in terms of communication channel, this has been highlighted in NYSC guideline. If there are any issues, any signs, anybody presenting with signs and symptoms at all in camp, quickly escalate to the next authority, which is usually the NYSC officials in camp. In terms of, you're going to be divided in platoon. So your next line of communication is your platoon head, as well as the platoon leader, and who will escalate it further to the NYSC state coordinators. Once this is done, there is a channel of communication. The information will definitely get to NCDC. We enjoin you to please comply with the protocol for safety. For any information on COVID-19 at all, our NCDC social media on Twitter, as well as on Facebook, on Instagram, is at NCDC Gov, as well as on the website. We can get all the information on the website, and we have all these details on our guideline. Everybody has a role to play. Everybody needs to ensure that they take responsibilities for themselves first, as well as for their colleagues, and be your brother's keeper while in camp. If you see anybody not complying, not using face mask, or complying to the laid down principles, kindly ensure that you report such an individual, so that decision can be taken and it will not affect you, and it will even not affect the other core members in camp. This is to ensure that we're safe, and please, let's take responsibility. Thank you very much. Over.
Thank you so much, Dr. Lado. Thank you. I'm sure that our core members, as I can see, we have 737 now participants. Please, you can still send messages to other core members that you know, intending core members, so they can join us in this morning. Thank you so much, Dr. Lado. And please help us start jotting down your questions. She said a lot, and you can definitely, you have a lot to ask. I have seen some questions already coming in right now. And then our guest speaker for this morning is going to talk to us about, he is the head risk comms at NCDC. Please, we cannot clap to encourage you to join us, but we are happy to have him with us to talk to us, Dr. Yahaya Disu, the core member as champions for health security. Thank you so much, Doctor. Can you hear us?
Thank you very much, Yo. I want to say good morning, the DG NYSC, the DG NCDC, and all other protocols duly observed. Our prospective core members, I say, I know I can't hear your voice, but the tradition is you respond, wa, copper, we. So the reason we're here this morning is for us to know our role in this and how do we play that role. And I like what the last speaker ended our presentation with: take responsibility. And then I am going to take it up from there. What does it mean to take responsibility? So if the host will permit me to share my screen, and I will want to do that right away. What does it mean to take responsibility? And actually, last batch of core members, we presented this, and then there was a push to change this topic, but we feel it is still relevant. And then the people who are here, this parents also need to understand what does it mean to take responsibility. They are linked to the larger roles that you are expected to play in the long run. And it also goes beyond taking responsibility for prevention of COVID-19. It is something that you can apply to every other thing that you do in life. So, and the first slide is, okay, let me put it in speaker mode. Sorry, I'm trying to sort that out for my system. Okay, slideshow, and it's and something is okay. Maybe I'll just manage with this but it will have been better if it is the other is bigger. So now, why take responsibility? This is my outline.
Please, can we mute our mic? Please, can we mute our mic? Doctor has the floor. This has the floor. Please, can we mute our mics? Doctor, you can go on. We have 10 minutes for this.
So what does it mean to take responsibility? And then taking responsibility for COVID-19 prevention, we need to understand the concept, and then how do we apply this in what we do. So at the end, participants are expected and should be able to know the concept of take responsibility understand Take Responsibility campaign for COVID-19 prevention, and apply Take Responsibility concept for playing their part in the COVID-19 Take Responsibility campaign. What is and why do we take responsibility? To thrive as an adult, you need to take responsibility for your actions. We need to take ownership for circumstances of our lives. We have the responsibility to take decision, to make a choice, because the consequences of what happens to us, and we should be ready to live with them. They are as a result of the choice we made before. So it therefore means that you need to externally own the consequences for the things you do and you don't do. In dreams begin responsibilities. That is, you have to be in the driver's seat of your life. And when things go wrong, taking responsibility is crucial to build trust with others. And that is way to build bridges, to heal wounds, and then to also learn from our mistakes. We can see this picture here, Mandela, and then we all understand what Mandela means to us. Eventually, we all have to accept full and total responsibility for our actions, everything we have done and have not done. So even if you keep quiet, you are taking responsibility. The consequences will still come of keeping quiet, or you feel you should not be involved. And then COVID-19 requires a collective approach. If somebody is not wearing face mask and you are wearing face mask, you are still not protected. You are only protected when everybody wears the face mask. So for us to achieve our collective goal, everybody needs to be on the same page. So how do we take responsibility? You are consciously in charge of yourself and you know what you want in life. It should be clear what you want in life. Before you enter university, you decided to take JAMB form, to choose schools that you want to go to, and the course you want to go. Determining whether you want to go in for that choice, for that course that you have been given, and then you still have to make a choice. And then how you succeed, that is going through the university, learning the necessary things and coming out. So it's still choice. And then,
please, Dr. Just hold on. Please, can we just mute our mics? Please, can we mute our mics so we can hear Dr. clearly? Because like we said, he has few more minutes to go. Please, can we just mute the mic so we can hear him clearly? You have the floor, Doctor.
So you choose how you respond to things in life. There are things beyond your control. There are things under your control. And there are things that are partially under your control. At least you can understand the one under your control, see how you address that. Then the one partially under your control, do what you need to do to collaborate, to ensure that you're able to take some control. What is under your control, you leave others. Now, I also want to advise us that it's blaming and complaining.
Just hold on. Please, can those in the control help us mute everyone's mic? Can they help us mute the mics?
Passport mute everyone's mic. One
and please, prospective core members, please listen attentively. The questions you are asking have already been answered. Some of the questions Dr. Disu is already, some of the things he's saying, we are still asking the same questions. Please, let's listen attentively so that The questions that you're sending in will not just and we'll miss out some. Please, let's.
Okay, thank you, Yo. So,
Yeah.
ask yourself, what is your role in this? Instead of feeling like a victim, you need to begin to feel like a victor. It's about perception. This cup is half filled with water, and this cup is half empty. You see the same level of water. How we see the cup determines what we do. What is the gain for me? Very challenging circumstance, but how we see it determines how we can take advantage of that to make sure that we mitigate its impact and we're able to maximize the benefit we can get from it. What can I learn from this? It's also a learning curve, opportunity to learn, and then become intentional in making choice. And I have resolved to do this, irrespective of the challenges. You need to have commitment and encourage to move on. And of
I don't see access now. I say when I come, I'll be back today. Tomorrow we'll see. Okay.
So what does it mean to take responsibility? We always think that we have a teacher, we have a coach, and it is their responsibility for the outcome that we want to get. Like if you fail, oh, my teacher didn't teach me well. A coach will be of great help, but it is the client who must take responsibility for implementing the agreed changes. Obeying instructions, that it starts with that. When coach tells you this, then you need to comply because he has more experience, he has been in that place before, and he doesn't want you to make the same mistakes he has made. Even though there are things that are inevitable, you still need to learn your own lesson. Then using information for improvement. Information you have, any information that you have, see how you can turn that information into action for you. It may even be just passing the information to somebody who needs it. Productivity is not a function of only you doing things. Sometimes you leverage on others, their strengths and what they have. And then you ensure that you play your own role to support others in achieving this. DG and CDC said earlier that we need your support to achieve this collective goal. We're not just thinking of you coming to have safe orientation and go back to the community, but we want you to play active role in ensuring that wherever you are serving, and you want people to wear their mask, to know that you're a champion, and then take initiatives from ideas. And sometimes the best ideas will come from you. You get to the field, you see challenges, problems, and you're able to take initiatives to resolve them in as much as it is in line with the principles that you are trying to promote. For COVID-19 prevention, how did it start? We launched the campaign Take Responsibility to prevent and control the spread of COVID-19 in Nigeria. And that was on the 22nd of March, 2020. And this is meant to be implemented, or everybody needs to be responsible. And then at the family level, at the group organization level, community level, institution, and then leadership level, everyone has to play. You will fit in any of these. As individuals, we belong to a family. We also highlight people, know that there cannot be any. Then community, we are in the, and then we are going to be part of the NYSC institution. And then you have your whole roles to play there in the community. You are also ambassador of NYSC. And then, of course, graduates. We are
Dr. Disu, I think the noise is actually getting too loud. Someone is sharing the link. So I think it's others. Please, let's just still mute. Please, Emeka, can we just mute others, please? Thank you, Doctor. You can continue. It's quiet now. Please, we don't want to remove anyone. But I think that's the next stage that we are going to. We'll just remove you when we notice the noise is getting too much from your end, please. All right. Dr. Disu, you can continue to speak, sir. Hello, doctor. Can you hear me?
Oh, okay. So we expect us to model preventive measures at our individual level or community or partner organization. And then we also leverage on the existing stakeholders and reach wherever we are. It is not about you. It's not about what you can do. You can leverage on resources around you, the stakeholders around you, organizations around you. We go into the community. We work in schools. We work with community and so on. Then we mobilize by sharing and promoting take responsibility message using the existing channels. We all belong to one social media group or the other, WhatsApp platforms, whatever means that we have, we can push the message. We all get the messages, SMS messages on take responsibility. We need to continue to push this. And while we do this responsibly, taking responsibility in a responsible way, or taking responsibility responsibly by not sharing misinformation, by verifying information before you push it to other people, by understanding the implication of this misinformation. Then we'll also mitigate by ensuring people understand the situation and use information in a way that will enable them minimize the impact of the disease. And what we say is there are things that are unavoidable. Now, this is inevitable, but we just have to cope with it. We have to devise strategies for minimizing its impact on us. And that is one of the things that responsibility is supposed to do for us. And then we also monitor by collaborating and providing regular feedback to NCDC, all the states where we are, even NYSC now, and then all other stakeholders that need to know when we get information, when you get what is happening in the community, when you see misinformation or people are trying to deliberately undermine the system or the effort. So we share the information with the relevant authorities. Some of these things you'll be taught when you get to camp. So are we ready to take the driver's seat? That is the question now. Do we want to just go there and collect our certificate and say, okay, this is all I'm here to do? Is that how we say take responsibility just to make sure that I protect myself? Or do you want to be part of the vehicle, but you are not the one driving? You just want to sit on the bonnet and for everybody to see that you have a vehicle, you know, that is going an extra mile. You have obtained your certificate, and now you have worked hard to get something, and then, but you are not driving. You are not in the driver's seat. Or do you want to be in the driver's seat? Yes, I've obtained this certificate. It has to make a difference in my environment. So the choice is all yours. Which one do we want to belong to? Thank you very much.
Thank you so much. Thank you, Dr. Yaya Disu. And then you've had it. Which one do you want to be? You want to take the driver's seat? Like you said, in a nutshell, we must be ambassadors for NCDC. We must be ambassadors to help propagate this message. Okay, I've been seeing questions coming in. Please, let's listen attentively so we don't repeat the same things that have been asked earlier on, that have been said earlier on. So please, our core members, just let's be attentive whenever we are in whatever it is that we're doing. All right, so we're moving on straight to the next thing on the program, which is the panel discussion. I don't think we might have more things to say, but even if we do 2 minutes each for the panelists to just say 1 or 2 things, and then I will read out some of the questions that we have here. And then our panelist for today is the DG of NYSC, Brigadier Schreiber. Please, are you still there, Brigadier? Like we say, Sean, sir, are you still there, sir?
I'm here. I'm around.
Yeah, thank you so much, Brigadier. And also, we have the one of our speakers earlier on, Dr. Oyeladun Okinromade. She's still there with us. I can see her. Yeah, thank you. Yes, I can see your wave. And we also now have the Dr. Yaya. He just finished speaking with us right now. He's head of RISCOM at NCDC. Dr. Yaya, are you still there with us? Dr.
Yes,
Yaya,
thank you, yes.
All right, sir. Okay, so we'll go straight. I don't know if the DG of, if Brigadier has anything to say right now, because he's the one that spoke earlier. He might not really have, he might have one or two things to quickly drop before we start to take questions. Sean, sir, any questions, sir? Anything you want to say, sir?
I think nothing much. All have been said by Dr. Ladun, Dr. Disu. Yeah. Just for purpose of emphasis that the safety protocols will have to adhere strictly to it. The social distancing, face masks, sanitizers, and so on. There's going to be enforcement team, vanguard in the camp, and everybody must comply. In fact, we will not hesitate to decamp any core member from camp who fail to adhere strictly to this protocol. Just as the speaker said, that failure to put on mask, not just you're only endangering yourself, but others. So we must adhere strictly to the protocol. Everybody must be tested, and it is only those that are negative, as they said, that we permitted to camp. Those that are positive will be handled by the NCDC. Please, Dr. Ladun also said it too, on the issue of information management, that don't resort to the social media and then you start causing problems in the camp. We have channel of communication where there are issues that require for you to be cleared. Please go to the appropriate channel so that for better understanding. We don't want to start hearing that so number tested positive, so camp, this and that, then we causing panic among parents and the general public. So you must adhere strictly to our communication channel so that you don't have any problem. And initially we announced January 18th as a resumption date for camp, but we now realize that the camp is 21 days, and your 21 days will terminate on Sunday. That informs why we decided to shift it to on the 19th. So you'll be reported on the 19th. And as they said also, please adhere strictly to the date on your call-up letter. If you turn up on the day that's not a call-up letter, we're not going to attend to you. So ensure that you adhere strictly to the date, because we don't want to avoid the issue of crowding and so on. And then, as we said, you must take responsibility. And I'm sure for those of you that have been monitoring our program on the NTA, NYSC, you must have seen what core members have done in the fight against COVID-19. So we are waiting for you to join us so that you also contribute in the fight against COVID-19 by producing sanitizers, face masks, disinfectant soap, sensitization, and so on and so forth, in aid of the NCDC, the PTF, and your fellow Nigerians, so that we have a COVID-free Nigeria. Thank you.
Thank you so much, Brigadier Shaibu. Thank you, sir. All right. I have some questions here. Some of those questions you've already answered, so I don't want to go back to taking those questions. But somebody asked a question here that I think is important. My call-up letter is dated October. Should I do another call-up letter, sir?
Yes, you are going to reprint. Okay. Such a prosperity comment will reprint. Once we release today, you are going to print. What you are going to print today on your dashboard is going to give you the date, the current date for 19th.
So you've heard it. If you are there, please, you have to reprint. Reprint so you can be a part of this particular batch. And then you heard what the DG said too. He said that the date is now from the 19th. So please, for those of you asking questions, when are we going to camp? When are we this? You've heard that. Another question here says, okay, I think it's Dr. Ladun that will answer this. How many nose masks should I come with to camp? Because you said that you are not giving any. People are asking, how many do they come with? They just want to know.
Okay, so they can come to camp as many face masks as they want, but it's advisable that they come with a cloth fabric face mask so that they won't keep adding to the waste that we're generating in camp, and they will just wash, iron, and reuse. So it is advisable to at least you have 2 fabric face masks. You use one and wash one, and also you have one spare that we can use. So if you cannot come with as many as possible, but at least make sure that you have 2, so that one is washed, one is available to use at all time. We try to discourage people coming in with disposable face masks as much as possible because of the waste that would also generate. Over, please.
Thank you so much for that, Alex. Please, another question here for DG. Is there any changes in the camp routine procedure? If yes, what are the changes? Are there changes at all? We know that Dr. Ladu explained that some of them, there will be social distancing for this, for that.
They will be tested immediately, and all those that are negative to come in will be registered.
Sir,
those with challenges will be handled. No changes. The procedures remain the same.
No changes. Yes. No changes. The same. So our core members, you are listening. No changes. Just that they are observing social distancing and all. All right. How will a prospective core member? Okay. For everyone, you said that everyone will be tested once they arrive, but how will everyone know if they are positive? I think they will be told, right? There's no need for that.
NCDC.
Dr. You have the floor.
Definitely, they're going to be informed. Like I said, once the result is available, we push it on the, we have an automatic generated SMS where they will immediately be alerted on their results. For those that are negative, for those that are positive, they are going to be informed physically because of the psychological effect that is involved. So we don't just push positive results by SMS. They're going to be informed, and they're going to be counseled in form of a health education and tell them the next procedure that it entails, more or less like a psychotherapy kind of procedure. So for those that are positive, we don't just push the text message to them.
Okay. All right. Okay, so you heard it, so they will counsel you. Coppers, intending coppers, they will talk to you. Don't be scared. You know, a lot of people are just scared. They are scared to hear that. I know someone that is not feeling fine, and I've said severally, go and do this test. And then the woman is just saying, just leave me like this. It's better I don't know. It's better I don't know. So don't worry, you'll be counseled. So there's nothing to be scared about. It's not a death sentence. My coppers, it's not a death sentence. Yes. Okay, someone asked the question here. Will NYSC provide vehicles, that is buses, for people traveling from the east to the north for the orientation camp, just to be on the safe side? Is that possible?
NYSC will not provide vehicles with the Federal Road Safety Commission and the transport unions to ensure that as our prospective commerce arrive the parks, they should ensure that only road vehicles will be allowed for the core members to use, and make sure that we give us drivers that are not drunkard, and that also to ensure that our core members don't travel at night. They should not travel at night. Their security is very paramount. We care for their welfare because we realize that most of the deaths during service here are on account of road traffic accidents, and that is why we've been warning core members on no condition should they travel at night. I can assure you that we have been partnering with the road safety and the transport unions for their safety. They should please adhere to our safety guidelines. Thank you.
All right. Dr. Tistu, are you still there? You talked about, even Dr. Lado also said the same thing, that everybody you should be the ambassador for NCDC and for NYSC. But what should core members expect in case there is reported cases in camp? Will the camp be shut down just in case?
Okay. Thank you very much. The reason we put
Is Dr. Jisu there?
Yes, I'm there. I'm talking. Can you hear me now?
All right.
Hello?
Yes.
Yes, we can.
Yes.
Yes, we can hear you.
That is the reason NCDC and NYSC are collaborating to ensure that they're able to first prevent transmission. All those protocols we say is to prevent transmission in camp. Peradventure, somebody is asymptomatic, and then on arrival in camp, the person tested or test negative, but he just got exposed the day before, and the result cannot show positive. But 5 days down the line, it will become positive. So, but we already know that when you use face mask, when you wash your hands, when you observe social distancing or physical distancing, the risk of transmission is very, very low. So in the case of such people, which may be few, and then we all have to be compliant to ensure that everybody comply with the measures. And that is the reason we don't want to close the camp, and we want to also ensure that you do your NYSC at the right time so that you can move on with your life. But if we disregard the protocol and we continue to transmit this in camp, and we are getting numbers that we are not comfortable with to allow the camp to continue to run, the camps will be shut down. But you take responsibility for that, for preventing transmission and for detecting. The reason we're also talking of detection is for such people who may become symptomatic after the test, after 3-5 days, even a week after they get to camp, you are expected to report yourself. You are expected to go to, there are NYSC, NCDC, health officials, state officials in camp working with you, and they continue to sensitize you every day what you need to do if you observe anything. And then yours is to report. If I have a headache and I don't say to anybody, nobody will know I have a headache. So you still take responsibility for reporting so that you can access care early, and then they will do quick assessment. In case such a person becomes positive, and then they will look at who has been in contact, they will trace them, they will test them, and then if they feel, he has not really spread this, then life goes on. If it's just a few handful of people that are affected, they might just tell those ones, self-isolate for maybe 1 week or so. Do you understand my point? So it all depends on the situation, and that will determine what decision will be made. Then in terms of response too, we also have facilities. We are collaborating with the State Ministry of Health to ensure that those people who are positive, whether on arrival or when they are in camp, they are taken for isolation in the treatment center. So this is the discussion we continue to have with the states. And this evening, we are still meeting with the state epidemiologists. The DG is meeting with them to emphasize this for them. So I think that it's all up to us. If all of us disregard the protocols, it's not even DG of NCDC. It's the DG of NYSC himself that will say, let's shut down this camp. We cannot guarantee safety anymore. So thank you very much. I think I'm able to answer that question.
Thank you so much. Dr. Jisu, once again, before I let you go, please, someone is asking, why would religious activities be scrapped even when COVID-19 protocols are observed? If they have their nose masks, just like you just explained, they use their sanitizers and all. Why scrap them religious activities?
Okay.
Dr. Jisu.
It's virtual. We'll have virtual. It's not scrapped. It's virtual. We'll have virtual religious activities.
Exactly. So
thank you, DG.
Okay, if I may add, that's exactly what I presented in my presentation. Virtual religious gatherings is not being scrapped.
So please, corpers, intending corpers, you heard it. You can do your religious gathering virtually. Everybody will just be there. All right, please, Dr. Jisu, just in case we have some few people that just joined us, just in less than 30 seconds, the whole essence of this meeting, the webinar, in 30 seconds, can you just give an overview of what it is that we are doing here, because of those that just joined? Some people just joined.
Okay, thank you very much. Call members, we know that you are here to serve the nation, and the nation is also taking responsibility to ensure that you serve while you keep serving where you are safe. So the slogan is keep safe, keep serving. You are serving your father's land, and you also need to take responsibility for your safety and the safety of the people around you. And the whole essence of this is to familiarize you with the processes that have been put in place to ensure safe camp operation, so that they don't come to you as, hey, I didn't know about this, but we have informed you, even though you've been hearing about this in the community safety protocols in the last 1 year, but how does it affect our camp operation? And then your cooperation is also important in ensuring that we all achieve our collective responsibility. And the third objective is that we also use this to understand your concerns, so that if there's anything we need to adjust or to prepare for on your arrival. And then we have taken note of all your questions, and then sure, the appropriate authorities will see what to do to address to them. And lastly, to link you to information sources, reliable information sources. You are all connected to all manners of platforms, getting information, but where you can verify information on COVID-19, NCDC website, or WHO website, or Federal Ministry of Health website. Anything outside that, then we won't advise you to do that. Then for vaccination, because vaccine is the one that is trending now. It is NPA-CDA that is leading. But any information NPA-CDA has, they also share with us on our website, and to also ensure that we disseminate. But always use the channels of communication in camp. If there are issues, if there are things you don't understand, ask people. Don't go to the media. It doesn't help anybody. And then some last time from a particular state, because they arrive in camp, maybe there's a communication gap, and then they just wrote presidency straight that they were asked to go back to their state. They could have lodged that complaint to NYSC, maybe contact. And then part of what we raised yesterday in our meeting was that the NYSC PROs in the state should provide a platform where prospective corps members can lodge complaints, so that we can quickly deal with this before they go to the public or they go to quarters where it will just generate unnecessary panic. And then it will look as if this whole essence is not safe. And because of that, if you write to presidency feel, oh, it's like we're not in control. They can scrap, they can say this is suspended. And who pays for it? It is the prospective corps members who should have opportunity to go and serve. Since we have a control process in place, we can all achieve this, and we have done it for 2 batches. It is successful. So in your own time, we believe that we can also learn better lessons that we can for subsequent batches. Thank you.
All right, thank you so much, sir. Dr. Ladun, please, someone sent a message here. It says, we had the accuracy of the test kits are between 40 to 50%. Based on this, is it still advisable for the camp to be open?
Okay, so thank you for that insight. It's like that they delving more into a little bit of technical area. So before we introduce the RDT at all, the kits in Nigeria, it has been accepted and validated globally. And in Europe and other countries, they've started using it. And from the WHO validation of the kit at the global level, the sensitivity and the specificity was well over 99%, which was about 99.5 and all that, which shows that at the global level, the validation, the kit was validated to be good and able to pick those that have infection on time. And looking at the peculiarity of Nigeria, we can't just take the global data we had to validate the kit in our own environment before we can declare that, okay, we are now in line with the validation. And that is the process we started with NYSC, being the first time Nigeria will be using RDT in Nigeria. And we use the first batch and the second batch to validate the process. And we're also going to complete the validation with the third batch. So far, we have experienced over 90% sensitivity as well as the specificity. To some people, this is a big grammar, and that's why I didn't put it in my presentation. In terms of sensitivity means it can actually pick those that have the infection and detect those that are positive as real positive. And in terms of specificity means it has 90% chance of detecting those that don't have the infection, which also is in line with the global validation. So we're not just rolling out something that does not have scientific background. It has been scientifically proven at the global level, and we have ensured that we achieve the same level at the Nigeria level. So there is no cause for alarm. The system that we put in place is to ensure that you are all protected while in camp. Thank you.
Thank you so much. Thank you, ma'am. All right. A lot of people on the radio show that I did, I had Alibaba on my show on Wednesday, and then we talked about COVID, and then people still not believing that there is COVID, and then a lot of people just still believe that, no, then they lie to us. It's big man sickness. It's only killing big people. It doesn't kill the poor man. When we gather, you know the killer. We gather at the market, it doesn't kill us. Nothing happens to us. So it's only rich men that are dying. I don't know if you have one or two things to say. Let me start with the DG first. If the DG NYSC has something to say, then I talk to Doctor and then Dr. Lado and then Dr. Disu. DG. They say it's for big man. COVID is for big man.
For those core members, the prospective core members that were mobilized for stream 1A and couldn't come, so some of them will be moved to the next stream. So that is the plan. And under normal circumstances,
I think I can. Is it my network?
I'm hearing you loud and clear.
All right. You can go on.
Okay, the prospective core members that were mobilized for stream 1A and 1B and couldn't come, they will be moved to the next stream, and that's what I'm saying. But I think Dr. Ladun and not able.
Dr. Ladun.
To all those.
Okay.
Dr. Ladun, they say it's for rich people.
Okay. In fact, sometimes when I hear information like this, I marvel. Because I presented a data showing mortality well over 1,000, almost 1,500. These are human beings like you and I. And from the statistics available to us, it cut across all socioeconomic class, all age group, and the commonest age group, at age group between 20 to 50. Which majority of our core members are within that age bracket. It does not differentiate or disaggregate whether you are rich or you are poor, or whether you are young or you are old. And majority of this information that people are getting that is a fake news of rumors or fake all about, it's on the social media. And that's why we're directing you to the appropriate channel where you can get accurate information concerning COVID-19. You go to our all the social media on Twitter, you go to the Facebook or NCDC Facebook. We even have Instagram page, because we know now that this generation is all about Instagram, Twitter. If anything is happening this moment, the next thing is to see it on Twitter. So we make provision to capture all that as much as possible. And I want to also encourage us that we should not add to the rumor. We should not add to the already existing fake rumor, because that is what is actually stretching our own system and our response system. we've put measures in place that you get the accurate information from the right sources. And also, we have partnered with media organizations, and that is why we have you in our program today. We have partnered with a lot of media houses to ensure that they pass the right information to the public. COVID is real. We are all witnesses to the fact that we were on lockdown for 3 months. Businesses shut down. A lot of people lost their jobs. A lot of people lost their incomes. A lot of people, there were a lot of hardships during that period. Would the country just go on lockdown for fun? We had a lot of financial loss as a country during that period. And schools were also on lockdown. You stayed at home for almost 1 year without being mobilized for camp activities. Would that be for fun? Those are the things we should also evaluate from our own head. So this is to also further reiterate that COVID is real. COVID is with us. COVID affects all age group. COVID affects all socio-economic class. Is not meant for the rich and is not meant for the poor. It's a pandemic. It's not even the disease of the black. It cut across all parts of the continent. And this is the first time that there will be an outbreak that cut across every part of the continent, apart from this small pulse of the past that has been eradicated as far back as 1977. This is the first time we're witnessing such a massive outbreak. And we need to ensure that we change our belief system, and also to ensure that we don't add to the social media rumors and discourage false information as much as possible. Thank you.
Thank you so much. And then Dr. Disu, just a quick one. We have a lot of, because we are rounding up in the next 1 minute, we have a lot of religious houses telling people that there is no COVID. Somebody called on my radio show on Tuesday, and the man point blank told me, yo, tell Nigerians to go and buy hand fan. Once they tell them they have COVID, make them use the hand fan, they find themselves and go, well, it is prophecy. I have the prophecy. And then I told the man, can we go to Yaba Isolation Center so that they tell them this thing? He said, no, just tell them they are hearing. I don't need to be there. And he said he's a prophet of a religious outfit, of a religious organization. Religious organizations telling their people, because a lot of people believe them. Dr. Disu, in 30 seconds, and we can please.
Okay, thank you very much for that. And I think we cannot control information that goes out to the public space, but we can orient our people on what they should consider as true and correct information, and how will they know this, and where can they verify this, and what makes sense. Of course, we know that we're in an environment where people believe religious leaders. We believe prophecy is part of our lives in Africa. So, but then at the same time, we also need to use our sense of reason to be able to discern what is correct, what makes sense, and what doesn't make sense. And again, we should be able to combine what is coming from religious leaders and with what the realities are, what the science is telling us, compare them, and then be able to make our judgment. You can't stop those, but we are trying to engage them, the religious leaders, to educate them, for them to understand. And COVID is not about test of faith, because when the virus comes into the body, your ability to overcome it is what we're talking about. And if you even have faith to overcome it, what about people around you, your loved ones, who don't have that faith? So we're talking about preventing transmission from one person to another. It's part of hygiene measure. In churches, mosques, you don't see them to put toilets or to make sure that they don't clean their toilets, because they know the importance of hygiene. So hygiene for COVID is face mask and hygiene that we talk about. So diseases will occur, but what we do is important. The responsibility we take before we now leave the rest for God. But for us to just say, this is a prophecy from God, we are not supposed to play our own part, we're deceiving ourselves. but we continue to engage. And then core members, definitely you are going to various parts of the country, communities, and then you will encounter this from time to time. It is your role to educate the people, to enlighten them, to be able to understand what is the correct information and how to use that information, and how not to contribute to spread of misinformation. So I think we'll continue to engage these religious leaders so that we try to discourage as many, as much as many of them as possible from sending out such misinformation. Thank you.
Thank you so much.
But then the media too, you have critical roles to play. You have critical roles to play too. We are all in this together. I say even the media, you have critical roles to play. And we really appreciate what you did too in that respect, in that regard.
Thank you.
And we continue to work together to achieve our collective goal.
All right, thank you so much. We are really, really sorry Ali Baba couldn't join us this morning. I don't know why. I also tried personally to reach out to him now, but so we're sorry about that. But we just want to say a big thank you to our Sean, sir. Your boys are looking at. Thank you so much, Brigadier Ibrahim, NYSC. Thank you, sir. But sir, the flog that they flogged me and camp, sir, I'm still looking for that army man. I want to join army because of that guy. They flogged me. I don't wake up every morning. Sir, okay. Thank you so much. And of course, a big thank you to the NCC, Dr. Chikwe. Thank you so much, sir. We are honored to. And then our panel, Dr. Lado, thank you so much, ma'am, for today. And then Dr. Yahayadi, thank you so much. And then Elijah Abubakar, are you still there?
I'm there.
Elijah is still there? Okay, I can see him. Thank you so much also for today. And then Emeka, for all the plenty calls, Emeka can call for life. Thank you, Emeka, all the team, all the guys behind. Thank you so much. Oh, I can see everybody. Thank you. Please, can you just wave us? Please, can you wave? Everybody, can you wave us? Thank you. Thank you. And for our core members, please don't forget the social media handle at NCDC. That is where you get us on Twitter, on Instagram, Facebook, even on Telegram. It's important to go there to find out information that you need. Please, don't do hearsay. Please, and be careful with what you spread. A lot of people forward a lot of fake messages. They spread these messages 24/7. They're always sending one message. And then you can get more information if you dial the short code *63232. You can go that way too if you want to find out more info about everything that concerns the NCDC. Thank you so much. My name is Nayo. The radio presenter, actor. Thank you so much, and it's been great doing this and for NCDC. Thank you so much. All right. So for now, we take the anthem just to sign out finally, if it is ready. Take the anthem to sign out finally.
Okay, so before we take the item, before we take the item, DG NYSC, you may take your seat, sir. So we would like to take a final word from DG NYSC on the advice to the core members as they prepare to go to camp on Tuesday. So DG NYSC, in person of Brigadier General, sir, please give us the final closing word before we take the item. Just
okay.
1 minute.
Thank you very much. I want to inform the prospective core members that their posting has been released, so they can go and check their dashboard right now. And I also want to, you have Dr. Ladun and Mr. Yo, you have said it all, and Dr. Bisu. Please, we are partners with the NCDC and the media. Please, the reportage should be factual. There's a need to verify information, and also the prospective core members. Please don't resort to use of social media. Go to the right source to get your information. Don't travel at night. Don't endanger your security. Please play safe. And don't hide whatever information you need to allow us know. If you are sick, please let us know so that we can take the necessary precaution so that we don't put the others in harm's way. You must take responsibility so that you don't jeopardize your orientation course. Because if you jeopardize it, as the NCDC official said, it is you core members that bear the brunt. Because we don't want to stay at home for too long, so that you finish safely and others that on the waiting list can join and also finish. And we are waiting for you so that we have a hitch-free exercise so that you can come and contribute in the fight against COVID-19. Thank you, and God bless all of you. Thank you, NCDC.